Hello everyone, it's time for a house call. I'm your host, Kim Becket. Diabetes. I am sure everyone watching knows someone that is diabetic. Some people have managed their diabetes since they were very young, and some have developed it as they've aged. Today on House Call, we are talking with board-certified retina specialist Dr. Adam Katz from the Center for Advanced Eye Care. He is going to explain the impact diabetes has on your eyes and the importance of routine eye care. Hi, Dr. Katz. How are you today?
Good. How are you, Kim?
I'm great. Okay, so talk to our viewers about the diabetic patient and why. I mean, I know that as far as eye care is concerned, it's much more complicated.
Absolutely. I mean, people with diabetes, first of all, what's really I find interesting, half the people in our country who are diabetics don't know they have diabetes.
Yeah, that's scary.
It is very scary. We actually...
And why is that?
Well, because people are not always aware of what the symptoms of diabetes are, or people aren't going for regular, not eye exams, regular exams, regular health exams.
Right.
So as a retina specialist, we look at the back of the eye, and we're actually able to make the diagnosis sometimes that a patient has diabetes without them even knowing it.
So that's crazy. So instead of going to their primary care doctor,
right,
they're coming to you to have their eyes examined because they're maybe not seeing that well.
And also, there are patients who will get diagnosed for the first time with diabetes, sent appropriately for an eye exam, and I'll see them and they will already have diabetic retinopathy. Now, typically it takes at least 5 years of having diabetes to form any type of diabetic changes in your eyes.
Wow.
So that tells us that this person obviously had diabetes a lot longer than their initial diagnosis.
Right.
Yep.
So, oh my gosh. So, I mean, I just think the take-home message here is absolutely get your eyes checked, because you and I have discussed this a million times, that the eyes are the windows to your soul.
Absolutely. I'm still amazed, even to this day. I've been a retina specialist for over 20 years, and it's still amazing how much information you can get from an eye exam. We have patients who we diagnose carotid artery disease on, high blood pressure, diabetes, you name it, we can pretty much detect it. It's the only place in the body where you can actually see arteries, nerves, and veins without any radiation. So even after 20, 25 years, I love looking in the back of the eye. People always say, you look awfully happy. I am. I like what I do.
Which is super important.
Yeah, I think so.
And like you say, I mean, it's really hard to believe that from a routine eye exam, you can get that much information.
Absolutely. On a daily basis, we're picking things up, so it's exciting.
Oh my gosh. And well, that's why you're a retina specialist.
That is why.
Okay, so back to our diabetic patient.
Yes,
So when a patient comes in and you've either diagnosed them that they have diabetes or they know that they have diabetes, is there a difference between like what you have to do with, say, somebody that's just found out that they have diabetes versus someone that is routinely being watched?
Yeah,
what changes?
Yeah, what I'm looking for on an exam with someone who has diabetes are signs of diabetic retinopathy, which means disease of the retina due to diabetes. So the earliest things that I'm looking for are what we call microaneurysms. They're these little tiny red dots. They look like red dots, but they're actually little outpocketings of normal blood vessels. The reason why we're concerned about that is they can leak out fluid, and fluid can form in the macula, which is responsible for giving you your good central vision. So diabetics can form what's called diabetic macular edema, or fluid in the macula. That's something that's treatable. And without treatment, it puts a patient at risk of vision loss, which can then be permanent vision loss.
Wow.
So a diabetic, we're looking for particular things. One, diabetic macular edema. And when diabetes is more advanced, we see what's called proliferative diabetic retinopathy. That refers to the growth of abnormal blood vessels. Proliferative diabetic retinopathy, untreated, will lead to blindness. So these are, serious conditions that, as a retina specialist, we're looking out for these things, and we're trying to identify, can something be treated? Does this patient have fluid? Does this patient have abnormal blood vessels? Treatment is great, it works. So people keep good vision, people don't go blind in general who are treated. So the issue, like how we started this, was you got to know what's back there in order to prevent future problems. And you can have advanced diabetic disease and zero symptoms. So we can't rely on our people will say, I see 20/20, what's the problem? That doesn't mean that there's, no issues, no diseases going on.
Right. Hence the super importance of a routine eye exam.
Absolutely, cannot stress it enough.
Hold that thought. I hope you're enjoying this terrific house call, and we will be right back with more information from Dr. Katz.